Hi, my name is Sydney Brunette and I'm a Jackson College nursing student. The title of this presentation is Pressure Injury Prevention Bundle. While in the hospital, there are many obstacles that a patient has to face, such as the stress of their diagnosis, being away from their homes and their families, not being able to have their daily routine, and many more. On top of all that, another thing that they have to worry about is skin breakdown. Everyone always hears patients complain about how uncomfortable the beds are and how they can't wait to go home and just be in their own bed. In some cases, though, patients aren't able to speak for themselves, whether that due to them being on a ventilator or any other circumstance. It's a healthcare worker's job to be vigilant and proactive when tending to the patient and their skin. That being said, the PICO question for this presentation is, in critically ill patients, does the implementation of a pressure injury prevention bundle decrease the incidence of pressure injuries in comparison to patients that do not have the bundle implemented? Upon researching this question, I was met with a lot of studies and information to go through. For pressure injury prevention bundles, they can either be single intervention or multi-intervention bundles. For the purpose of this question, the studies selected focus on multi-intervention prevention bundles. It was found that most institutions that had some sort of bundle implemented saw a decrease in the number of pressure injuries that developed in patients. Now, in comparison with the bundle not being implemented, they compared it to beforehand before they had any sort of protocol. In the study done by Wenny et al., they concluded that having a bundle implemented decreased the incidence by as many as 4.6% to 36.2%. which is a wide margin due to the fact that more stronger research is needed in that area, as it is a gray area. The bundle implemented consisted of a skin risk assessment scale, skin assessment and care, repositioning, nutrition, education, support services, and a medical device care. Although this bundle is implemented, there are some people that develop them no matter how cautious and careful staff and they may be. The clinical implications implementing a bundle would provide are it may help patients be at a lower risk for skin breakdown due to the vigilance and care, it can prolong the development of a pressure injury, and it can completely save some patients from developing one completely, or from worsening one that they may already have. It can also save the hospital itself from a lawsuit if they have policies in place to protect patients and their skin while under the hospital's care. In conclusion, with hospitalizations occurring so much more frequently and durations of stay being longer due to COVID and other illnesses, it's extremely important to protect critically ill patients so that they don't have to deal with the trouble and trauma a pressure injury brings, on top of what they are already dealing with. Although there is an abundant amount of data to back this up, there is a need for further and stronger research in this area. For example, each hospital can conduct their own study for their environment and adjust accordingly to the results they conclude with. Thank you.